So we ran a little late to talk a little bit about ADHD and anger. And part of the reason is because it's been a busy morning seeing a few ADHD kids that are having some problems with anger. Um, Parents often have questions about ADHD and how it relates to mood in particular and anger um, especially. And it turns out that the two are very related. First of all, ADHD can affect mood because it produces a lot of frustration. Um, Kids are having to work harder to accomplish similar things, and so it tends to generate a little bit more frustration. And then when they are not successful, one of the things that can happen is that they can get quite angry about that. The other thing is that they hear a lot of negative messages. ADHD kids are more likely to hear a higher number of negative messages. Don't, stop, quit, why did you do that? Why didn't you do that? And so they begin to hear those negative messages at a fairly young age, and over time that gets old. And so they begin to have more of an angry, or in some cases a shutdown reaction to that. To make matters more complicated, not only can ADHD and our parenting response to it being so negative lead to anger, the medications that we use for ADHD can also cause an irritable or angry attitude, and that can be especially true for the amphetamine-like medicines, such as Vyvanse and Adderall. But this is not always true. In fact, many ADHD patients, their mood improves and they get less angry with the medication. So the important thing to do is to keep an eye on how the medication affects mood, especially with regard to the time of day and the number of days out of the week that you're experiencing these anger episodes. So if the anger is occurring in the afternoon or in the evening as the medicine wears off, those can be rebound symptoms from the medication, and they may respond to slight increases in medication or using an afternoon medication or changing the medication. If anger is present all day and during the medication effect, a trial off of that medication to see how it affects mood is an important step to take. If you are having problems with other areas that are related to ADHD, anxiety or sleep problems, depressed mood can sometimes seem angry. I always say, especially on boys, sad can come across as mad. And I think that you have to look at co-occurring mood and anxiety disorders when there are a lot of anger problems hanging around with the ADHD. So I wish that it was simple and that there was a one-size-fits-all, but those of you who know about ADHD know that that is rarely the case. It's usually more complicated than that. So let's just review three areas that we need to think about. The first is that ADHD itself can be associated with mood issues because of the frustration, because of the reaction of parents, peers, and teachers being negative to so many ADHD behaviors. That in and of itself can increase anger. And I always say parenting, good or bad, doesn't cause ADHD, but negative and punishing parenting strategies can certainly light anger on fire as a result of ADHD. So one suggestion would be to look into behavioral therapy, which is for the parents and for the teachers, not for the ADHD child. The behavioral therapy is learning those positive parenting strategies that really help. The second thing is evaluate the role of medication and how the medication is affecting the anger cycle. So anger that occurs at the same time every day, especially if that's in the afternoon or evening, may be because of medication rebound, the ADHD coming back as the medication is wearing off, or if it's during the time when medication effect is there, it could be the medication itself. So a trial off medication or adjusting the afternoon schedule for medication can often solve that problem. Finally, there are the ADHD tag-alongs or comorbidities, the other conditions that are associated with ADHD. And these include, again, anxiety, mood problems, and sleep problems. If they're not sleeping well, if a young person is not sleeping well, it's very easy to get frustrated, and that can turn to an angry disposition pretty quickly. Irritable symptoms, irritability, and being more angry can be associated with anxiety. In addition, depression and other mood disorders can come across with a significant amount of anger response. So those are things to think about. And one final thing, if there is this mood thing in the afternoon, make sure that your child is eating some protein at lunch, because often they don't feel hungry at lunch when they're on their medication. They don't eat enough, or they eat some simple carbohydrates and they're having a crash in the afternoon. And a lot of times something as simple as adding a peanut butter sandwich or half of a peanut butter sandwich at lunch, or some other good source of protein, will help stabilize blood sugar, and then they'll feel better. I hope that this will be helpful in addressing this very common problem that we see along with ADHD, and that your days and afternoons and evenings will be less stressful, less angry, and that your family will have improved mood as a result of some of these tips. When there's a question, always talk to your child's health care provider to make sure that that they can help you address those issues. Thanks for tuning in live, and we'll be back again soon.